I'm Jeff Canoyer, and I'm an exercise physiologist at Nova Southeastern University. Today we're going to be talking about heart rate variability because to me it's one of the most important metrics that we can possibly have to make sure that you are exercising correctly, which is why, in my personal opinion, heart rate variability can change the way that you exercise for the better. So, before we start talking about heart rate variability, I think it's important to kind of go over some of these other metrics and what they actually mean. So for example, what is heart rate? So heart rate is just the amount of times that your heart beats in a single minute. So as you can see here, we're seeing this lovely animation right here. The heart, when it goes through a beat, it means that blood is flowing through all four of those chambers. It's moving in through one of the atria, moving out through one of the ventricles, and it's being circulated either to the lungs or to the rest of your body. And every time you get one of those heartbeats, usually with this forceful ventricular contraction, which is where you're seeing this big beat rate down here, usually when you're seeing that, that's when you can feel the pulse in your wrist. So when we're talking about what is heart rate, it's really just the amount of times that the heart goes through this entire cycle every minute. So heart rate is very indicative of heart health. So we can tell a lot of different things from what we're looking at in heart rate. So, for example, resting heart rate. We know that for the most part, this can change during exercise, but for the most part, resting heart rate tends to be around 60 to 70 beats per minute. That's what we consider to be average. That can change with training especially, meaning that if you train hard enough and in the correct way, you can actually lower your resting heart rate to be, in the 50s or sometimes even in the 40s. That's okay, that's normal, but that comes a lot of times with a lot of heart rate training and a lot of exercise training and all that. Now, if we take a look at maximum heart rate, one of the easiest calculations that we can use is 220 minus your age. This can usually be used to determine things like your heart rate zones. You might have seen on the treadmill you have those different zones where if you're at a certain percentage of your maximum heart rate, that indicates that you're in the cardio zone or in the fat burning zone or whatever the case is. While those zones might not necessarily be the most reliable things in the world, we can use 220 minus your age to kind of at least get a rough estimate of what your maximum heart rate should be. That doesn't mean that that's what you should always aim for, but it's a great idea to have that. And honestly, one of the most important metrics that's coming out of heart rate is what's called heart rate recovery. So what we want to look for is we want to have a normal heart rate recovery of about 30 beats per minute reduction every minute until you get back to your resting heart rate. Now this can vary quite a bit from person to person, but when we look at your heart rate recovery, especially after a very, very intense exercise, that is really indicative of heart health. And actually, as we can see, 12 beats per minute or less of a heart rate recovery, meaning that your heart rate is recovering much more slowly than it should be, is actually predictive of sudden cardiac death. So being able to monitor this and being able to make sure that you're nowhere near that low level of heart rate recovery is something very, very important to do. So when we're talking about heart rate variability, now we're going to move into looking at something that's a little bit more nuanced. So to do that, the first thing we want to do is we want to look at the electrocardiogram. Now this is, pretty much everybody has seen these waves in one way or another. This is what's created when we put the leads on your chest, or this particular one is actually gathered from my Apple Watch, and we see, what's going on in the heart. So essentially what we're seeing here is the amount of electrical signal that the heart is actually putting out at any given time. We know that because the muscles of the heart, just like any other muscle in the body, has the ability to contract, and when it does so, it sends out these electrical signals. So when we're talking about these in the medical scientific world, we like to label the parts of the wave to give us an idea about what exactly we're talking about. So for example, you can see we have the P, the Q, the R's all the way up here, S, and the T. All right, those are the most typical. There are other letters that people will use as well, but this is kind of the most basic aspect of an electrocardiogram. Now, the most important part about this electrocardiogram is when we're looking at this big spike right here, which we tend to call the QRS wave, all right, or the QRS complex. This is what's happening when you actually feel your heart beating. Again, when you put your finger on your wrist or on your neck and you feel that pulse, what you're actually feeling is the really forceful contraction of that lower big part of the heart called the ventricle. When the ventricle is contracting, that's when we're getting this massive QRS complex, okay? And the reason that that's important is because what we're looking for when we're looking at heart rate variability is the amount of time that we see between these QRS complexes. And that's what our next slide is about. So for example, when you take a look right here, when we look at an electrocardiogram, we have the ability to measure the distance in milliseconds between each one of these waves. Now what this is called is R to R variability. Again, the top point of each one of these EKG waves is the R wave. And now, so we're looking at the amount of time that's measured between each one of those R waves. So you can see, for example, that we're not supposed to have, this is a healthy heart rate variability, we're not supposed to have completely consistent distances between these R waves at each given time. We can see some are slightly longer than the other, 1240 milliseconds as opposed to 1060 milliseconds. That small variation and the amount of time between the R waves is what we call heart rate variability. All right, and as you can see here, the definition that we're looking at is the small differences in the time between successive heartbeats, meaning that we don't necessarily want each one of these beats to be exactly equidistant from one another. And that brings us to the conclusion of one very popular research article on heart rate variability saying that the heart is not a metronome. We actually want to see small variations in the time between heartbeats because that actually tells us that there's a nice healthy interplay between two very important parts of our nervous system. The part of the nervous system that controls fight or flight and the part of the nervous system that controls rest and relax. All right, so generally speaking, the higher the score, the better. As of right now, unfortunately, there are no normal values for this. So if we were to calculate the amount of distance between each one of these, I believe if I calculated this earlier, and I believe it was right around 30 milliseconds, which is good, but we don't necessarily know what is good and what is bad just yet because there's no necessarily normal values where we can use equations to predict by your age, gender, height, weight, all that sort of stuff, what your heart rate variability should be. It's still kind of a newer field of science. So, talking about those fight or flight versus rest and relax nervous systems, those are two branches of what we call the autonomic nervous system. This is the nervous system, this is the part of the nervous system, I should say, that is responsible for pretty much everything that happens automatically in the body. When your heart beats, when your diaphragm contracts so that you can breathe, how wide your pupils are, what kind of food and how quickly that food is being digested, all that sort of stuff. The autonomic nervous system is the part that really controls that. Now, there are two branches to this. There is the parasympathetic nervous system, which we can see kind of highlighted in the blue over here, and then there's the sympathetic nervous system. Those two branches should have a really nice interplay between the two of them. So the parasympathetic nervous system, which has the nickname of rest and relax, that nervous system is meant to kind of calm down the body, to slow down all these processes, to slow down your heart rate, to slow down your breathing, to constrict your pupils because you don't need to let as much light into them, to relax the muscles of your digestive tract and all that sort of stuff. So the sympathetic nervous system, on the other hand, speeds up all the different processes of the body. That's why it has the nickname fight or flight. It's because your muscles are contracting tighter, your pupils are dilating, meaning that they're letting in more light so you can see much more around you. Your heart beats faster, your respiratory rate grows, and all of these other sorts of processes will speed up, again, getting you ready to kind of run if need be. So what we like to look at for this is we want to try to see that there is some sort of autonomic balance between the two of those. That way there is some sort of healthy interplay between each one of these. All right, so we see a little bit of a rocking of the scale in one direction or the other, but eventually they all kind of end up balancing one another out. So that way, if we put a stimulus at any part on this scale, it's not going to tip. Even if we put two stimuli on either end, everything is still going to remain balanced. At this point, you have generally high heart rate variability. You have a decently normal resting heart rate, meaning that it's, again, between that 60 and 70, and your resting breathing is about 12 breaths per minute, which is what we would want it to be. What happens then is if you have some sort of stress, and we're going to discuss what that stress technically is in a second, but if you have some sort of stress, then all of a sudden, this scale gets tipped. Now, this is when your fight or flight nervous system, otherwise known as that sympathetic nervous system, that's when this part of it is overactive. Now, pretty much anything you do imbalances that scale. No matter where on this scale you go, there is some sort of imbalance that is being contributed to this, and essentially you get stuck in that fight or flight. Meaning every time you do any sort of exercise, your body is going to overreact to that exercise, and it's going to think that you're getting ready to run, even if you're just going out for a walk. This is not necessarily desirable, which is why we wanted to try to do some sort of parasympathetic training if you are imbalanced. Now, I should say that you can also be parasympathetically overtrained as well. It kind of depends on what activities and what exercises you do on a regular basis. That's something else that we're going to be able to get to here. But for now, what counts as stress? All right, of course we know that emotional or mental stress, that's the typical stress that we think of, or psychological stress, all those are different sorts of stressors, but we can also think about, especially in the terms of this scale that we just saw, that there are physical stressors that can happen as well. So there are injuries that you can have stress over, there are surgeries that you can have stress over, or there is exercise. So if you only ever do overly intense exercises, such as doing a lot of sprinting, or doing something like CrossFit or Orange Theory, or doing any of those exercises that are really, really, really heavy, if that's all you ever do, and you don't modulate that with some of the lower intensity exercises, then you can, again, get stuck in that fight or flight sort of mentality. Same exact thing can happen if we do low intensity exercises. That can stimulate the rest and relax, the parasympathetic nervous system. So if you always just go for walks and everything like that, then there is a chance that you end up getting stuck just in that parasympathetic nervous system where that scale kind of goes in the other direction. So the question that you want to ask yourself is there enough balance in my exercise program? And that's where our next section comes into play. So we have exercise and how that actually affects heart rate variability. And then, once we know how that affects it, then we can actually start to utilize this very, very useful metric to be able to help you balance your exercise and maintain good health in that whole process as well. So, before we get into that, we want to talk about, what is recommended for the amount of exercise that we do. So the American College of Sports Medicine, the Centers for Disease Control, the World Health Organization, a bunch of different organizations have recommended something for the amount of exercise that you should be doing on a regular basis. So the most typical recommendation is 30 minutes of exercise per day, as long as it's moderate intensity exercise. If it's high intensity exercise, you can lower the amount of time that you do it. If it's lower intensity exercise, you might want to increase just slightly the amount that you want to do as well. A couple of years ago, though, the American College of Sports Medicine actually changed that recommendation to include a very important word, which is cumulative. All right, it's not necessarily always that you want to go out and just do 30 minutes of hardcore exercise or moderate intensity exercise on a daily basis. But what you want to try to do is start the engine more often. So if you're only doing, a little bit of exercise on your lunch break, 10, 15 minutes of exercise on your lunch break, then you go for another 5 or 10 minute walk right when you get home, and then another one before you go to bed. Something along those lines, so you can accumulate 30 minutes of exercise. That ends up being actually a significantly better type of exercise than just going straight up one time a day and then being sedentary for the rest of the day. The Center for Disease Control and the World Health Organization have a very similar recommendation because they say 150 minutes of moderate intensity exercise per week. So when we think about that, what they're essentially saying is the same thing. We want to do 30 minutes of exercise per day, and you just can give yourself 2 rest days. So whatever the case is, these are the recommended exercise programs that the American College of Sports Medicine or these other organizations recommend. So why am I mentioning that? Well, because what we've seen is since 2006, we've seen this really nice incline in the amount of people who are actually meeting those guidelines. That's awesome. And what that means is that as a nation, we are getting fitter. We are actually doing more exercise and achieving the goals that are set forth by all these scientific organizations. The problem is that along with that, the vast majority of people that were surveyed didn't really know what intensity levels they were achieving during exercise. So that whole moderate intensity sort of situation, are they actually doing that? Are they going too hard? Are they not going hard enough? The problem is that some people just don't necessarily understand what these really subjective terms mean. Even the people that are using these recommendations might not necessarily be able to define them well enough to make sure that you are doing the right amount and intensity of exercise for yourself. And if we see what the problem can be for that, that sort of misunderstanding about the intensity with which you're supposed to exercise is exactly what can lead to overtraining or non-functional overreach or something like that, where essentially, once again, you're getting stuck in one of those two branches and the scale is getting stuck on one of those two ends. So what we want to try to do is we want to use this heart rate variability to give us the ability to see when and how our bodies are being affected by exercise. So what we want to do is we want to take a look at different exercise zones in the body. All right. So first we have a long, slow distance exercise zone over here. This is the sort of thing that really takes into account the parasympathetic nervous system. You can see that on this scale, you get, to maybe about 2/3 of the way through this scale, and at that point, you're still doing long, slow distance sort of exercise. This is really good low intensity exercise. It stimulates fat metabolism really, really well. And it's really good to counteract the high intensity exercises that you would see on the other side of this scale. When you're getting up to 100% or technically even higher of the amount of intensity that your body can handle, that's when you're in these really high intensity intervals. This is where CrossFit comes into play. This activates the sympathetic nervous system, and again, it's high intensity. It stimulates carbohydrate metabolism mostly. And it counteracts the low intensity. So you can see that these two zones have a lot to do with one another, and you want to have a nice balance of these two zones. All of a sudden you take a look at this zone in the middle and you can see that there's something called the junk zone. Now, what does that mean? What that means is that it's a combination of both of the other two zones, meaning that it's too intense to get your really good low intensity benefits, and it's not intense enough to get your really good high intensity benefits. So it's one of those things where if you're exercising, this is usually where people love to exercise. This is where they're the most comfortable, because when they're in the long, slow distance zone, it just feels too easy. You don't think you're doing enough, but you're really actually doing quite a bit in this zone. When you're doing high intensity training, that's really difficult, and it feels like you're doing really hardcore training. So a lot of times people like to live right in this middle zone where you're breathing a little heavy, you're sweating a little bit, but you're not killing yourself at the end of it. The problem is, again, you're not getting any of these good benefits, and all you're doing is, if you do end up having an imbalance of your autonomic nervous system, this is just going to make it worse, exercising in the junk zone. So make sure that when you're doing exercises, do you want to do a low intensity day or do you want to do a high intensity day? It's a very, very important distinction. So once again, we're going to take a look at this scale, and we're going to see that when we're doing high intensity interval training, we are really tipping the scale in this direction. Now, doing this just for one day, it's not going to do anything, right? Your scale is still going to be able to rebalance, just like we saw it kind of wiggle in the first slide that I brought the scale up. But what this is going to do is, if you do this chronically, over and over and over again, you're going to see sustained increases in your heart rate. You're going to see heavier breathing. You're going to be burning a lot of sugars, and you have the potential for overtraining syndrome. The exact opposite can be true if we do too much long, slow distance training, where if we're only balancing the scale on the other end, now your heart rate can't get high enough. It ends up just staying really low all the time, and you can't actually increase the heart rate at any point. Also not good. So this can also increase the chances of getting overtraining syndrome, just in the opposite direction. So what you really want to do is you want to do exercises on both ends of that scale to make sure that you are balancing this scale out at the end of the day. So in a nutshell, moderation and balance are key, right? If we're doing an exercise for the parasympathetic nervous system, you're going to strengthen that parasympathetic nervous system up really well, and as you can kind of see in this illustration, you're going to make the parasympathetic nervous system win that tug of war all the time, and you're going to just go crazy over into that direction. On the other hand, you can see the same sort of overtraining syndrome where that tug of war is being won on the other end if you only ever do high intensity training. So the point is to be able to maintain a balance of both of those. So what does heart rate variability have to do with all this? We know that we want to have some sort of balance, but how does heart rate variability help us? Well, thanks to a lot of like technological manufacturers, whether you're looking at the Apple Watch or Samsung or Fitbits or whatever the case is, a lot of different technologies nowadays have the ability to measure heart rate variability. Is it always the most reliable measurement source? Not necessarily, but if you're always using the same measurement source, you're going to be able to see how your body reacts to some exercises and how it reacts to others. So what you can do is you can take a look at trends. Not necessarily the end-all be-all. So you can see that this one is my heart rate variability on a single particular day and kind of how it bounces around. I can see that I had one exercise that really raised my heart rate variability, meaning that I had balanced it out with something else. So usually, because most people tend to exercise too intensely, usually the low intensity exercises are what, at least for me, tend to raise my heart rate variability. If I do a high intensity exercise later in the day, you can start to see that this heart rate variability trends downward. So it's a good idea to not only take a look at your heart rate variability, but to also understand what exercises you have done throughout the day or what sorts of stressors you have used or you have experienced throughout the day to make sure that you are keeping an eye on what is affecting your heart rate variability. With sustained training, you can see that over the course of a week, you might have one day that, really raises your heart rate variability, but then it starts to fall off. It's nothing that you need to overreact to just one given day about, but having heart rate variability be something that you use to determine how your body reacted to an exercise. When you did that exercise, did your heart rate variability increase? Well, good. That means that you counteracted something that was keeping it lower. When you did another exercise, did it really deplete? Well, that means that that's the part that you're probably more apt to be overtrained in. So if you went for a walk and you see that your heart rate variability tanked, you might actually want to look into doing something that gets you breathing a little heavier and gets you working a little harder, or vice versa is also completely true. Lastly, you can also see that this should be the most stable of the trends, but you can see yearly trends and see if there is anything that you've been doing on a more chronic basis that really allows your heart rate variability to thrive. Once again, what we really want to try to do is we want to try to make sure that we are keeping an eye on heart rate variability and monitoring potential symptoms of overtraining syndrome, because these are really dangerous symptoms if they go untreated. If you try to push through them, they can get worse and worse and worse, and you can get farther and farther and farther into that imbalance, and that's obviously not what we want. So if you have some parasympathetic overtraining, what that can kind of show up as is fatigue, depression, or kind of really chronically lowered heart rate. Not necessarily at rest, but you can never get your heart rate to increase while you're exercising. Meanwhile, sympathetic overtraining syndrome, which again is usually the more common of the two, has things like insomnia, irritability, lack of concentration, and that really hyperreactive heart rate that says as soon as you go for a walk, bam, your heart rate's in the 120s, 130s, 150s even. So we want to make sure that we're keeping an eye on the symptoms of our exercises as well as what our bodies are telling us through things like regular heart rate and heart rate variability. So again, what you really want to try to do is monitor your heart rate. You want to become aware of the symptoms that you're in the effects of exercise, and you want to stay healthy during your exercise routine. The last thing that you want is to have an exercise routine that ends up making you worse, where you can't exercise in the future. Now you need to become sedentary. And that's nothing that anybody wants, because exercise, of course, is an extremely healthy thing to do, and we want to make sure that you're doing it in the best way possible. I'd like to thank everybody for taking a look at this presentation today, and if you have any questions, please feel free to leave them in the comment section down below, and I look forward to hearing about any of your comments. Thank you so much, and have a great day.